You might think that this is an example of a denture, but actually I didn't remove a single tooth to do this case, and this is just temporary transitional bonding. I'm going to go through this case with you step by step in my thought process and show you how we got from the top picture to the bottom picture. So here you can see this patient came in, he hadn't been to the dentist in a while, he had multiple broken teeth, you can see some cavities on some teeth, and actually in this area and this area back here, he had implants placed previously, like over 10 years ago, that he just hadn't had restored. He had severe dental anxiety and just was really wary of restoring things and going to the dentist. So obviously a person like this comes in and they're very embarrassed with their smile, and they have a lot of shame surrounding this. How did I let it get this far? That type of thing. And so the goal is to figure out, what is your end goal? One, are we trying to save as many teeth as possible, or are you wanting to get rid of things and place more implants potentially? And for this patient, it was really important for him to keep as many of his natural teeth as possible. So obviously some of those front ones that are broken off, that's going to be a hard task to keep those, especially this one right here where there's very little tooth sticking up from the gum line. In its current position, it would be pretty impossible for me to put a crown or to put any sort of restoration on there. And so we have to kind of think out of the box. Now, another thing that I asked this patient is if he would be open to doing some orthodontics. And the reason I asked that is because one, he definitely has some crowding in the lower, but two, if he decided that orthodontics was an option for him, I could use that to orthodontically extrude this tooth out of the gums to give me a little bit more restorative space to put a crown on top of it. Now, how do we do that? How do we get him something that looks better in the interim? I did this with a procedure called transitional bonding. And essentially, composite bonding is a material that a dentist hand layers on your teeth. I use a technique called injection molding, where the design that I designed how I wanted his smile to look, I use an injectable composite and bond it directly to his teeth. So each of the teeth are separated, they're not connected. This is the day that I did the transitional bonding. My goal of the transitional bonding in the ortho, one was to extrude this tooth, two, to intrude this tooth. This is an implant, so it's not going to move, and this is an implant, so it's not going to move. But I can actually use those implants as anchorage to help move the adjacent teeth. Now, as this tooth extruded, it got quite a bit longer. So you can see here how the edge of this tooth is down quite a bit further from everything else. But the benefit of composite bonding is I can just shorten that. So when it came in and the tooth was hanging down a bit, I would just shorten that at appointments until I got it to where I wanted it. Once we finished with the orthodontics, I took everything off, put him in retainers. When he's ready, we'll convert everything that's transitional bonding to porcelain veneers and crowns in order to give him the smile that he likes. So this is kind of a cool case. It's a complicated case. It's an example of thinking outside of the box. There's not one right treatment plan. It was important for him to keep his teeth. He could do it if he was open to some orthodontics, which he was. And I think this is a really beautiful result.